Welcome back to the KFYR Plus News Desk. And a drug-resistant fungus now is spreading rapidly through the country's healthcare facilities, raising alarms among infection control experts. Candida auris now can linger on surfaces of a treatment and threaten vulnerable patients. Joining us now is infection prevention specialist Rayne Guest to explain some of the risks. Good morning and welcome to the News Desk, Rayne.
Hi, Jay.
So for
Let's talk.
For viewers who may be hearing about Candida auris for the first time, can you give us kind of an overview of what it is and why are health experts so concerned about it?
Yeah, so Candida auris is a drug-resistant fungus, and the reason they're so concerned about it is because twofold. One is it can colonize the skin on patients, where the patient will stay asymptomatic, and so you don't know you have it. And then also it lingers for a long time on surfaces. So it can live on surfaces for up to a month. And since it lives on surfaces and skin, it passes around healthcare settings very swiftly from patient to patient.
So what makes this fungus different from more familiar hospital-acquired infections?
Well, some of your other hospital-acquired infections, like C. diff, for example, that is a spore, not a fungus. And then also
hmm
you have staph, right, which is a bacteria. So between the three of these, we're talking about 100,000 deaths a year annually in hospitals. And the thing is, a lot of these are preventable. So one of the issues that we have in hospitals today is there are few disinfectants that actually are effective against C. diff and C. auris because they're very tough to kill. But in hospitals, the number one line of defense generally is not disinfectants that kill them. So I would argue as a infection preventionist that we should absolutely be using products that kill these pathogens as our number one defense because they're kind of like dishes you leave out overnight. If you don't kill them right away,
hmm
they become tougher to kill as time goes on.
So the numbers are climbing across the country, and so what do you think is driving this rapid spread of it, and how does it start to begin with?
Well, we don't really know where it originates from. It could be environmental, but it does come from patient skin. So let's say you have a patient come in that has their skin colonized with it. They're not showing symptoms of it. Then the
hmm
patient is in the hospital for a term, maybe they're staying overnight for a few nights. And by that time, because they're not using products that actually kill it and it lives on the skin, uh, they contaminate bed rails and different equipment and different things like that. So pretty soon it just, spreads everywhere. And that's why it's spreading because we're not using products that kill it on the surfaces. And then actually on the skin, a lot of, how they do Italian showers kind of in hospitals with the wipes? In
Yeah.
clinical trials where they're in a very controlled setting, those wipes only kill about 24% of it on the skin. So we need better answers to kill it on the skin, which I'm a big fan of hypochlorous acid. As you know, I have a technology that produces it. Hypochlorous acid is actually what our white blood cells naturally produce to fight pathogens, and it's highly effective against C. diff and C. rf. Our bodies recognize it. It's actually used in products for wound care, and different things. So there's no reason why we should not be studying actually bathing patients in hypochlorous acid to kill it on patients' skin. And then we should be using disinfectants that are hypochlorous acid based to kill it on surfaces around hospitals. And we should also be screening patients more effectively because really you just have to do a culture swab of like an armpit or a groin area, and that would catch about 88% of the cases right off the bat. So we're not doing things really to prevent or kill it, but we do have a
hmm
lot of companies coming out with ways to treat it, which I have an issue with because I think we should try to prevent people from getting sick versus treating them once they are sick.
So, what are the symptoms of Candida? What do you have a fever? What happens to a person's body with it?
Yeah, so again, when it's on your skin, you're asymptomatic. But once it gets into your blood system, through, let's just say, like a catheter insertion or something like that, then you're looking at getting, fevers and chills and different things like that. But those are pretty generalized symptoms when you're in a hospital. A
hmm
lot of things can
Sure.
cause those. Yeah,
Yeah.
but ultimately, when it gets into your blood, it can cause sepsis. And then once you get sepsis from it, because a lot of the patients that get Candida auris are already very weak, anyways, you're looking at a 30 to 60% death rate. So it is very important that we kill it before it gets to that point.
Who should be most concerned about the infections? Is it those that are in the hospital? Is it hospital workers? Visitors to the hospital?
Everybody should be concerned about pathogens in hospitals because they're a hotbed for it, right? It's a petri dish. It's like a preschool. You got a bunch of people in there with bugs, and especially in hospitals because you have people that are immunocompromised. Nurses and healthcare workers should be especially concerned about it because they don't want to be passing it from patient to patient. They don't want to put on gloves to protect themselves, touch a patient's skin that's colonized with it, and then accidentally touch a catheter that's getting inserted to them because that's how it gets introduced to patients. So everybody just really needs to be aware of it. But again, these are all pathogens that can be killed. So we need to be doing what we can to kill them so
Rayne,
that they don't spread and that people don't get it.
Can healthy people get sick from Candida, or is this primarily a threat now to already so the folks that are dealing with serious health conditions? As you mentioned, our white blood cells naturally will prevent it, but can healthy people really get sick from it?
Healthy people can get sick, but like other illnesses, if you have a really strong immune system, the odds of you dying from it are less. And, the odds of you getting in a hospital are greater because you're in an area where you're getting catheters inserted into you and different things, right? So
Yeah.
it has to have a pathway to enter into your bloodstream for it to be really hazardous and cause the sepsis.
You've worked with hospitals and nursing homes for years. Where
Mhm.
do infection control plans often break down in the real world?
Right from the start. Absolutely right from the start, because we are not using products that actually kill these really tough pathogens right off the bat. And a lot of generally the majority of hospitals and nursing homes are using quaternary ammonia-based products. And these quaternary ammonia-based products generally have to sit wet on a surface for 10 minutes to kill germs to be effective. And even if the hospitals were to let those products sit on the surface wet for 10 minutes, which by the way usually requires 3 applications to happen, then they would have to use a second additional product to kill C. diff and C. auris because the quaternary ammonia-based products don't work. So we've actually done time-based studies with Christus healthcare system is one of them, for example, in Texas, and they're a huge healthcare system out here. We worked with their environmental services team to actually show how long it would turn a patient room to use the products that they were using effectively. And it would take an hour and a half to do so because of the long extended contact times and the dual products that have to be used. Now, with our product, it was 28 minutes because it's one product, 1 minute that kills all of it. But unfortunately, the standard process for that healthcare system is still those original products. So people aren't making the switch that needs to happen, even though logically and technically and legally it is what is supposed to happen. And unfortunately, the people who are suffering are the people that need the most care.
How limited are the treatment options when a patient develops a serious infection?
Yeah, like I said, it's resistant to a lot of antifungals, so it's fairly limited right now, which is why we're seeing a 30 to 60% death rate from people that get it. Now, maybe this is just the sinister side of me, but I think that the reason we're probably seeing more about it in the news, because this has been an issue for a long time, right? This just didn't happen today. But I believe that probably the issue or the reason we're seeing it more now in the news is because there are a few drug companies that just got fast tracked to deliver new treatments. So I think that's why we're seeing more of it. But we're not seeing anything again about prevention, which really concerns me.
So the average
Another way that
person,
things are,
oh, I'm sorry, go ahead, Rayne. Go ahead.
well, I was just going to say another way that things are really broken down in hospitals from an infection prevention standpoint is hand sanitizing. And this is true for what we're being taught as well. So we're being taught generally, hey, wash your hands with soap and water or use an alcohol-based hand sanitizer. Well, alcohol-based hand sanitizers don't kill norovirus and they don't touch C. diff. So why is that the standard of care in hospitals? Again, they should be using something like hypochlorous acid, but it's what our white blood cells make, and you can produce gallons of it for a penny a gallon. So it's not profitable. but I
Oh,
wish they would make
yeah.
it. Yeah,
Yeah, I can see where you're going with that.
yeah.
Okay, as we wrap things up, Rayne, if you had 30 seconds with every hospital administrator in the country, what's the first change that you would urge them to make to help stop the spread of this candida?
Use a product that actually kills the germs, logically. You
Hmm.
know, if you had soldiers from an invading country come to your front door, do you let them in and say, hey, have a meal, come set up shop in my house? Or do you say, keep out? What we need to be doing is saying, keep out to all these pathogens. It's logical for to use products that actually kill it. That's just the number one thing. It's so easy. It's infection prevention 101. Kill the germs on the surfaces and kill the germs on your hands before they have a chance to infect you. It is infection prevention 101, and nobody's doing it.
Do you think that this problem is going to get worse before it gets better?
Oh, absolutely. Absolutely, because you do not profit from preventing problems. You profit from monitoring problems and treating problems. And that's the way our nation is going. We saw it during COVID, and we're seeing it with all these infections now. We see it with, all the foodborne illnesses that are coming out as well that we're seeing in the
Hmm.
news more and more. We have healthcare grade disinfectants that are food safe. Why are we still using sanitizers? To put it in perspective, passing sanitizing testing is like joining a track team. Passing healthcare grade disinfection is like joining the Olympics. So why aren't we upping those standards as well? There's very easy ways to solve these problems. I would say that the gaps are being kept there intentionally.
Okay, Rayne, we'll have to leave it right there. It's always a pleasure. Thank you so much for the insight on this. I appreciate it.
Good to see you, Jay.
Thank you now. Bye bye.